Hi everyone, and welcome to TS Fibro. Today I'm going to talk about number one in the Introduction to Fibro video that I made. If you haven't seen the video, go back and listen to it and you'll understand where I'm at. Because number one was muscle soreness and bone pain. Each fibro person is unique because we differ in symptoms and the severity of pain. Keeping a record can help you identify muscle soreness versus fibromyalgia. Fibro symptoms can include general stiffness and achiness or flu-like symptoms, fatigue and tension, headaches. Fibro pain can manifest itself by burning, throbbing, shooting, stabbing, numbness, tenderness, and muscle twitches. Pain can occur simultaneously in different parts of the body and may be felt every day. Because of increased substance P, which is a neurotransmitter, in the spinal cord, fibromyalgia people perceive pain 3 times to the degree of that of a normal individual. Whereas muscle soreness is localized and can occur 24 to 48 hours following a workout. Why does the muscle pain happen anyway? The American Fibromyalgia Syndrome Association, they explain that while muscles hurt everywhere, they are not the only cause of the pain. Instead, the diffuse body-wide symptoms are greatly magnified by malfunctions in the way the nervous system processes pain. Regional muscle pain not related to arthritis or the nervous system also occur in the majority of people with fibromyalgia. Patients describe this as firm knots in the belly of the muscles, often causing restricted movement and radiating pain. Basically, what all this means is that while you're in the middle of an intense muscular pain due to a funky nervous system, you often simultaneously experience more painful symptoms throughout the body because always feeling like you have the worst flu in the world just wasn't enough. Theories on muscle pain and fibromyalgia. The University of Maryland Medical Center published an in-depth report of fibromyalgia, including findings of abnormalities found in fibromyalgia patients. They found that fibromyalgia patients may have lower levels of ATP. These are chemicals that regulate the levels of calcium in muscle cells. Calcium is an important component in the muscle's ability to contract and relax. If ATP levels are low, calcium is not pushed back into the cells and the muscles remain contracted. They also speculate harm to muscle function of fibromyalgia patients due to pain and stress that accompanies it. This is really starting to sound like a self-perpetuating system, don't you think? They added some researchers have seen overly thick capillaries, the tiny blood vessels, in the muscle of fibromyalgia patients. The abnormal capillaries could produce lower levels of compounds essential for muscles' functions, as well as reduce the flow of oxygen-rich blood to the muscles. Muscle pain and fibromyalgia go together like milk and cereal. That means that if you are questioning whether or not you have fibromyalgia, then you must be experiencing some sort of deep muscle pain. And what's worse is that it has no boundaries, which makes diagnosing it even more difficult. Even though researchers still are not sure what exactly causes fibromyalgia, they are learning reasons why we suffer the muscle pain. It is true that there are plenty of people who don't care about why in life, but others of us simply cannot sleep at night until we find the answer to that question. Ultimately, though, our hope is that a better understanding will help us figure out more effective ways to treat fibro pain. Apart from pain in fibromyalgia, there's also symptoms of fatigue, sleep disorders, stiffness, headaches, irritable bowel syndrome, memory or concentration problems, etc. Bone health is also significantly affected in fibromyalgia patients. How does fibromyalgia have an effect on your bone health? The first of many effects on the bone health of fibromyalgia is the findings that a large proportion of fibromyalgia patients have low blood levels of 25-OH vitamin D. Although vitamin D levels are persistently low, there are no significant differences in parathyroid hormone or calcium levels. Some patients do have biochemical osteomalacia. Low vitamin D levels could also be explained by the fact that the patients may be too debilitated to get adequate sun exposure. On examining the bone mineral density, it is usually seen that fibromyalgia patients have difference in density at the mid-distal site in the radius bone in the hand. This usually indicates long-term rather than short-term bone loss. The spine bone mineral density in these patients is also low. Studies have shown that fibromyalgia patients compared to normal persons are much more likely to be smokers, to have had previous fractures, to have used steroids or anticonvulsants, drugs used in epilepsy, that increase the risk of getting osteoporosis, to have a family history of osteoporosis, or to be less physically active. Also, clavicle or shoulder pain in fibromyalgia is like any other symptom in that it can easily come and go, but might be more common than you think. It's common for fibromyalgia sufferers to experience pain in the shoulders, upper arms, and or clavicle, which is the collarbone that runs between the shoulder blade and the breastbone. This pain is just like any other fibromyalgia symptom in that it can easily come and go. Some people might suffer continuous pain, while others notice it more when they are overly tired or when they are using certain repetitive motions. The way fibromyalgia patients describe their shoulder and clavicle pain varies as well. Some describe it as a stretching or twisting muscular sensation, while others say more of an indescribable ache that cuts down to the bone. The pain may stay in one place for some people, while it tends to move down the arms, across the chest, or into the neck for others. If you feel the pain radiating and moving, it is likely to be connected to trigger points. These trigger points that we often refer to can be dormant or active and can become activated by a specific turn, move, injury, illness, or accident. Also, if you or someone you care about is suffering from constant or reoccurring pain in the shoulders, upper arms, and or clavicle, don't assume that it's only due to fibromyalgia. Some people suffer with this pain for months or even years without checking with the doctor because they assume that it's the fibro. There are many other things that can cause pain in this area of the body. This goes for anything that you're experiencing. If you have not been diagnosed with fibromyalgia, please don't see all these symptoms and assume that's what you have. Please go to the doctor and get checked out. If it's fibro, then you know for sure. And if it's something else, then you can get medically treated for that. So please don't just assume. Other possible causes of shoulder pain and fibromyalgia include not only trigger points, but a recent accident of any kind, even one that occurred in another area of the body. Increased neck pain due to an accident or trauma to the neck can also make you more susceptible to pain around the clavicle and shoulder areas. In fact, if you suffer from morning stiffness around your neck area, this can easily radiate in the collarbone clavicle area. Improper posture of the upper body can also instigate this pain or exacerbate when already there. With posture, most people tend to lean forward more than they realize, and this is easily exacerbated by excessive use of cell phones, computers, desk work, carrying kids, washing clothes, and more. Starting to be more aware of your posture is a great start. When you are standing or maybe standing in line, bring your hands back together on your lower back as if you're getting handcuffed. Not that I would know. Is this uncomfortable for you? Then yes, it likely means that your posture is suffering and contributing to the pain in the upper arms, shoulders, neck, and the clavicle area. You can also increase this posture technique by adding a free weight, 1 to 8 pounds or whatever you're comfortable with. Thank you for joining me, and if you like this video, please hit the thumbs up. And if you like my channel and would like to get notified of any future videos, please hit the subscribe button and the notification bell next to it. Thank you, and have a blessed day.